all of Bermuda, and welcome to our slimmed down COVID updates. A decision was taken by the cabinet to switch our COVID updates and updates which will take place featuring the Minister of Health and myself will take place on Tuesday evenings at 5:45. To the economic recovery and ancillary items. And so tomorrow, the Minister of Finance will be giving a press conference, and also on Thursday, the Minister of Labor will be giving a press conference. I will now turn over to the Minister of Health, who will give the latest COVID figures from her ministry, in addition to updates and changes which were agreed by the Cabinet earlier today. Minister?
Thank you, Premier. Good afternoon. Today, there were 734 test results received by the Ministry of Health, and none were positive for COVID-19. Bermuda has had 172 total confirmed positive cases, and their status is as follows. 157 have fully recovered, and there are 6 active cases who are all under active public health monitoring. None are hospitalized or in critical care, and the total deceased remains at 9. The average age of all of our confirmed cases is 57 years of age, and the age range of all of our positive cases is between 18 and 101 years of age. Overall, 50% of cases are Black, 40% are white, and 10% are other or unknown. The source of all of our local cases is as follows. 64 are imported, 87 are local transmission with known contact, unknown contact, and 2 are cases, and the 7-day average of our real-time reproductive number is. Bermuda has now performed nearly 46,000 tests, ranking us 7th in the world for tests per capita and the highest in the American continent. The intensity of our testing regime is enabling us to keep our borders open and our economy recovering, and to do so safely. Out 100% as long as there is a global pandemic. But our public health border control mean that we can promptly identify and isolate new cases to contain the spread within our community. I'm immensely grateful to the exhausted Ministry of Health teams and our partner government agencies, including tourism, transport, customs, and national security, for their part in this critical undertaking. Regarding testing matters, I am pleased to announce today that we are currently building capacity in our care homes for them to do their own COVID-19 testing. This should significantly speed up and simplify the testing process for our most vulnerable population, and also free up into health. As it currently stands, residents are already tested in their respective care homes, but staff must attend pop-up testing sites. And we are looking to do all of this testing in-house in the very near future. Regarding travel updates, I can inform you that starting the 9th of September, we will launch an approval process for the travel authorization applications. Travel authorizations will need to be purchased between 1 to 3 days prior to travel. This is to allow the pre-departure test uploaded to be reviewed and approved as part of the application. A valid pre-departure test result must meet the following standards: display the traveler's full name and date of birth. The date of the test must be within 7 days of departure. The test results must be negative. The test type must be a PCR test. The test must be performed by an accredited laboratory. A display of the full name of the laboratory and contact information of the laboratory. And if a traveler's pre-departure test results is deemed valid, then they will be issued the travel authorization. Visitors who do not submit a valid pre-departure test will be notified that their test is not valid and will be given the opportunity to submit a valid result. If a visitor cannot submit a valid test result, then they will be denied a travel authorization and will not be able to travel to Bermuda. Residents who cannot provide a valid pre-departure test will be issued a travel authorization and required to quarantine, as we've announced previously. Travel authorizations will be vetted between 9 a.m. and 8 p.m. Any traveler needing an emergency traveler authorization issued the day of travel must contact the COVID hotline. Also from next week, the travel authorization fee for travelers arriving without a pre-departure test will increase to $105 to cover the cost of the quarantine bracelets, which are required to ensure persons adhere to the required quarantine until they receive a negative day 8 test result. Moving on from travel, our movements in Bermuda must continue to follow physical distancing guidelines. I fear that in private settings, in particular, many people are forgetting the basic rules we have established when the world's fight against coronavirus started. No handshakes, no hugs, and no kisses. We Bermudians are warm, affectionate people, so I realize that this is hard for us, but please resist the urge to touch anyone outside of your household or small contact bubble. Keep your distance, bump elbows or feet to greet, bow elegantly with a gentle namaste if you are so inclined, but please avoid greetings and activities that involve physical touching. Further, the Ministry of Health is reminding residents that all restaurant patrons must wear a mask at all times when not seated at their table. This includes entering the premises as well as exiting, as well as when you're using the restroom. The wearing of masks in these instances is compulsory, and dining establishments are required to enforce these rules. I would also like to remind members of the public to please provide your contact details at the businesses that you visit, such as bars, restaurants, gyms, salons, theaters, and recreational charter boats, in case the Ministry of Health needs to contact you about a possible COVID-19 exposure. For more information about contact tracing or anything else related to COVID-19, please go to coronavirus.gov.bm. I end by reminding us all to avoid the 3 C's: closed spaces, crowded spaces, and close contact settings. And always, as usual, to wear your mask. Thank you.
Thank you very much, Minister of Health. And you are certainly right that it is difficult, but important. All of the work and effort of which we put in over the past few months. Minister, I do note that you had stated that we are 7th in the world in testing and top in the Americas. And I would just say that I'm so proud of the work that you and the Ministry of Health have done, and the entire teams that have been out there to scale up this massive testing effort. I know that we were a little bit nervous in July when it was the thoughts of the reopening of the airport and the increased volumes of testing, but I would say that your team has done an incredible job, and the country is certainly grateful. And I know there's a significant amount of hotel workers that are grateful as well, as they've been able to return back to work, as we have defied some of the skeptics and been able to reopen our economy and our tourism industry safely. As the minister noted, that persons that are landed in Bermuda without a pretest are now being tagged with bracelets, the quarantine bracelets, and those started on Monday. So big thanks to the team at the Ministry of National Security in combination with the FinTech team for standing this matter up so quickly. As was noted, that the price is going to increase to cover the cost of those bracelets, and they will be fitted for anyone that does not have a pretest. As I stated when I opened, these press conferences with the Minister of Health and I will be every Tuesday following our cabinet meeting, so the latest updates can be given out of cabinet. And as I said, tomorrow, the Minister of Finance will be speaking on matters pertaining to the economic recovery. And on Thursday, the Minister of Labor will be speaking to matters about jobs around the basis of economic recovery and the jobs plan to make sure that we get Bermudians back to work in the country. So with that, I'm happy to take any questions from members of the media at this time.
Right behind you.
Burgess, Bermuda Broadcasting. Health Minister, you talked about people coming in having to have all the forms filled out properly. What problems have there been up to this point? It seems like from stories that Bermuda Broadcasting has heard that the airlines have been allowing people to travel here without everything being correct.
The forms that you're referring to are the travel authorizations. And there were instances in the early days where some of the airlines were allowing persons to embark on the plane on the travel to Bermuda without having first completed the travel authorization form. The travel authorization form is extremely important for a number of reasons. One, it provides us with all the contact details of the traveler so that if circumstances are such where they need to have public health guidance and monitoring, we know how to reach them. We have those contact details. And secondly, the travel authorization also requires the traveler to upload their PCR test results so that we know when they arrive, they have a PCR test that shows negative that was taken within 7 days of their travel.
Thank you. Aruba is somewhat similar in population size to Bermuda. Aruba has also handled the virus very well until this month when cases suddenly exploded. They went from 0 active cases to close to 2,000 new infections in August. The vast majority of these cases are local transmission. Somewhat similar to Bermuda, Aruba requires pre-testing and testing upon arrival. In Bermuda, we have seen recent cases of local transmission, and one of the tourists testing negative on several occasions and then later testing positive after spending time all around the island at various businesses. Did Cabinet or has Cabinet ever discussed this scenario potentially happening in Bermuda with a large outbreak after being so careful?
I don't want to speak specific to the specifics of Aruba, but I suspect that they are not ranked 7th in the world with respect to testing as we have. In fact, we are the leading in the Americas, and that would include, of course, Latin America and the Caribbean. However, the position that we have, as we've articulated previously, is critically important to the ability for us to manage our borders and to survey the incoming travelers with respect to COVID, because we have such an aggressive testing regime. So in addition to having testing upon arrival with the PCR test, which of course is the recommended internationally, we have testing that takes place on day 4, day 8, and day 14. So we have constant testing mechanisms in place to best protect against persons traveling within our community having COVID. We have seen instances where persons have been tested on day 4, but had we not had a day 4 test and had we done as other jurisdictions have, where they just have a test on arrival and then the person is free to filter throughout the community without any other subsequent tests, then we would have found ourselves in similar circumstances as those islands to the south.
Thank you. Some parents have reached out to Bermuda Broadcasting concerned about students being allowed to return to school after day 8, after returning from traveling and having 2 negative tests for their parents or themselves, but only if they are older than 10. The incubation period for COVID is 14 days, and there are kids under 10 returning to Bermuda and preparing to re-enter schools. Is there any rethink about making mandatory 2-week quarantine for returning students? If not, why not?
As we have discussed previously, and in fact, the chief medical officer also opined on this, that there is a less instance of transmission with respect to younger children. And we feel that our testing regime is quite rigorous, and that for children that are over the age of 10, provided that they have 2 negative tests within that 8 days, as well as they continue to quarantine, then them returning to school or summer camps is appropriate. Clearly, we will continue to monitor the situation. And if that circumstance changes, then so will likely discussions surrounding the testing regime that may also be changed.
Thank you.
Mm-hmm.
We've also had people ask us that New York has recently started or will be starting doing testing on incoming passengers at both JFK and LaGuardia. And they wanted to know, would this test count as their pre-test for residents returning to Bermuda?
As I understand it, with respect to the test that's going to be conducted at New York, they are not PCR tests. So in order to arrive in Bermuda with a pre-test, you have to download on the on the travel authorization, a PCR test. I understand from the information that I've read with respect to New York that they are antigen tests, but in any event, it's not a PCR test. And it's required under our legislation. In order to enter Bermuda, you must have a PCR test as a pre-test, as a pre-departure test.
All right. Thank you. And my last question is for both yourself and the Premier. Now that we're 6 months into...
It's only been 6 months?
Well, 6 months is the daily press conferences.
Oh, really?
Really? Okay.
Well, it was March 2nd, I think, was the first one. We're pretty close to that. With regard to the pandemic, what are your best decisions that you've made to date, and what would you have done differently?
Well, I think because we're still there. So I would hate to jump to any conclusions and answer your question, because unfortunately we are still in the pandemic, and we would anticipate being in it for quite some time until we have an opportunity for there to be a cure or alternatively a vaccine. So I think that as a country, we have forged ahead and addressed the pandemic and the circumstances surrounding it very aggressively. We have pivoted when the needs called for that. We have made decisive decisions very early in the day, particularly as it relates to the sheltering in place and implementing certain other public health measures to help to mitigate against further spread within our community. So I think Bermuda's done a remarkable job under the leadership of our premier, and the fact that Bermudians by and large have adhered to the request of public health guidance. So I think we've done a really good job, and I'm sure that we will continue to do so and make inroads.
You're asking the best decisions. The Minister of Health, for the most part, nailed it. But the thing is, it's about making sure that early on we listen to the experts. But listening to the experts doesn't mean that you take the advice fully. You need to be willing to challenge the advice of which you are given, to make sure you think through the situation, to anticipate things which may not have been anticipated, but also to make sure that you know that you may not always be right and you may not always have the right answer. So I think through this perspective, it's about making sure during this, the best decision was to listen to the experts, to consult, and to make sure that you had the courage to say, number one, I might not agree with this and to go against the grain, but also have the wisdom to be able to say they may have the right answer. And even though I feel that this is the way we need to go, we need to make sure that we listen to the experts. So I think that it was during this situation and during this pandemic, the best decision which we made was to certainly listen to the experts, work as a team, and to build collective unity in the country the way going forward. So hopefully the next 6 months will be just as good. We have a month until election, of course, but I sincerely hope that we continue down this path of collective action, and I have no doubt that we'll be able to do so. We're changing the laws constantly to take into account any of the changes, but if you look at what we've done thus far, I think that the decision to listen to the experts, to make sure that we challenge what is being said, and to build our, I guess you could say, unique setup here in Bermuda has worked well.
Thank you both.
Thank you, Don.
Thank you.
Good evening. This is a question for the Premier. Premier, after the parliamentary registrar announced yesterday that people in quarantine because of recent travel will not be allowed to attend polling stations, the leader of the One Bermuda Alliance raised concerns. He said he was concerned about where we are with, quote, all of the confusion over COVID, and added that people won't be able to vote if they have the coronavirus, and the people are trying to travel home to vote will be unable the time. Had, quote, a nerve to have the mixed status announcement yesterday after the general election was called, meaning those people who benefit will still be unable to vote. And I wondered if you wish to respond at all to Mr. Cannoneer.
What I'd say is what's important in managing the country during a crisis is the ability to be calm, to look dispassionate situations, and be able to have a clear mind and thought of where you go ahead and execute. To be clear, the statement which was put out by the parliamentary registrar yesterday in consultation for the Ministry of Health states that persons who have decided to travel overseas and will be traveling back to Bermuda, it laid out in very nice time in advance on the to an order vote. No one is stopping any quarantine, and that might discourage other people. So we in a safe election or the government has done with the which of a week of others register. So exercise accommodations for those persons who are allow persons who are sick and shut in to be able to be visited at home. So we are proud of the work, guys, and I'm not going to be baited into angry back and forth with the opposition of mixed status families. Is upset with the timing, but the government was dealing with a pandemic. And though the changes to the laws were passed in March, said is he operationalize them. What the a lot of that time was spent making sure that this process would be a quick, simplifying the forms from a multi-step to make progress on our election promises. The government said that we would engage in bipartisan immigration reform. We engage in bipartisan immigration side to lead in that manner of having bipartisanship so interest the country and our balance. It's which is today in his press conference, he says that we should opening our. We take a balanced view, and we're going to. That is what served us right, and the economic record of our virus shows that between 2007 there were 719 more jobs in Bermuda than there were progress that we're proud of.
Thank you. There's a situation on the docks at the moment, and I know that you paid a visit to the picket line. Do you have any update for us, or do you have any view?
What I will say is that the role of government in these situations is to be there to be an independent body to mediate any dispute of which occurs. It is certainly a challenge when this level, but I am hopeful that the work of the Minister of Labor and the Ministry of Labor will be able to bring the of this dispute. I'm not going to speak to the facts of the case. I'm not going to speak to what has happened, but I think that it is incumbent on employers of this country to ensure abiding by the spirit and letter of the law, making sure they're abiding by their collective bargaining agreements and working in a spirit of harmony with labor to make sure that as a country collectively, we can get through this difficult time. Until next year's tourist season, it is going to certainly be a challenging time for our economy. And so we are going to do the work from a government perspective to put more projects in the pipeline that the Minister of Finance will speak about tomorrow to stimulate economic activity in Bermuda. But what's important is that for the private sector to continue to work with their employees through this difficult period and not to engage in actions which may be provocative.
Thank you.
Those are your questions?
Yes.
Thank you very much, members of the Turner. Very good. That concludes our press review.
The only thing I'll say is, as I had mentioned, there will be press conferences this week for the Minister of Finance and the Minister of Labor. Minister of Finance will be speaking to issues surrounding the economic recovery, and the Minister of Labor will be speaking to issues surrounding the jobs program to get more Bermudians back to work. I wish everyone who I probably will not see on camera before next week a very happy Labor Day weekend. Make sure that you are staying safe, and thank you, everyone. So thank you, and good night, Bermuda.